Welcome to H&HN Daily. I'm Susanna Hopsollerin, Senior Editor for Hospitals and Health Networks magazine. In healthcare, communication can mean the difference between life and death. After an in-depth analysis of gaps in communications, the Texas Children's Hospital Systems team designed an intuitive, easy-to-use communication solution for mobile caregivers. Today, I'm joined by Dawn Majors, Assistant Director, Information Systems Project Management Office from Texas Children's Hospital in Houston, to discuss using smartphones to improve clinical workflow. Welcome, Dawn.
Thank you, Susanna.
Thanks for joining us today. Describe the Rapid Communication System and how it works.
Well, at Texas Children's Hospital, we understood that there was a key challenge we needed to address. We needed to ensure that our healthcare workers who are mobile and that are not tied to a workstation or tied to a phone can also send and receive effective and efficient communication. So we implemented a single device that takes advantage of commercially available software solutions that's implemented on an Apple iPhone. And those functions within that Apple iPhone help to support two-way communication via messaging, via voice communication, as well as alarm notification. And those alarms are prioritized, as well as support automated escalation procedures to ensure the right people are available at the right time. It's a solution that we're proud of. It's a solution that's being used by the nursing department, by the physicians, and other stakeholders across the organization, including environmental services and bed management.
How did the nurses like it, and how does it fit into their workflow?
The nurses have responded very positively to the Apple iPhone and the smartphone that we've implemented. They've implemented it into their own workflows by providing themselves with reminders when they need to check back with patients after administering patient medication. They use it to communicate with environmental services when a room needs to be turned over to indicate that a cleaning activity is required. They use it also to communicate amongst themselves. So if they need support and help from other nurses that are on the staff, they can quickly press a button and send a message, and some of those messages are pre-canned to solicit support within the bedroom and ensure that those patients are safe.
What did you learn from the initial rollout of this project?
We decided that a big bang approach to the rollout was not the best alternative, that a phased approach was the best approach. We took an organizational change management approach. We planned, we acted, we studied the results, and then we acted again. That approach helped us to understand that some of the initial planning assumptions that were made were valid. Clinical leadership was a critical success factor. That was validated. We needed to ensure that the right leaders were involved and engaged in driving the initiative and adoption as we continued to roll it out. We also understood from the phased approach that the workflow component was critical. The expected outcomes had to be identified up front. The actions that the users needed to take as they received messages needed to be understood. And we focused on those pieces from a training perspective. Being that we're leveraging the Apple iPhone, the use of the phone, the use of the device is pretty intuitive. We all have smartphones, so how to operate that phone is very intuitive. The training really focused then on how do you integrate that with your workflow and making sure that all the users were very clear on how to respond to the messages that are being received.
How has the use of the Rapid Communication System fostered collaboration among the clinical staff?
We've been very successful with rolling out the iPhone smartphone across the entire organization. One example of how it has improved collaboration is as we get new demand for patient beds within our organization, it helps the people who are on the units to communicate to environmental services, to bed management, that rooms need to be made available for the next patient to come in. There's a Nurse Call Smart panel that can be invoked to send a message directly to the smartphone by the bed management staff. When they get the message that the room has to be cleaned and turned over, a person is immediately dispatched to go and turn that room over. And once the cleaning activities are done, That person, that staff member, will then press a button to indicate that the room is available. It helps us to place patients who need beds in an inpatient setting to get into those rooms as soon as possible.
Thank you for joining us today.
Thank you.